Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Take a glass of water in your hand. Look at it for a second. Do not treat it as something ordinary. Treat it as a tool that speaks directly to the brain, the bloodstream, the kidneys, the heart, and the stress response system. Now ask yourself, why does something so simple often get ignored when people talk about pressure, anxiety, fatigue, irritability, and mental overload? Why do we immediately think of complicated methods, expensive supplements, or dramatic lifestyle changes while one of the first biological signals may be this? The body is running its stress machinery with too little fluid support. Stress is not only a feeling, it is a physiological event. When a person is under pressure, the brain activates the hypothalamic pituitary adrenal axis, the HPA axis. The hypothalamus signals the pituitary gland, the pituitary signals the adrenal glands, and the adrenal glands release cortisol, one of the body's major stress hormones. That system is protective when it works properly. It helps us wake up, respond, focus, escape danger, and adapt. But when that system becomes overactive, even ordinary demands can feel heavier than they should. Medical references on stress physiology describe the HPA axis as a central part of the body's stress system, not a poetic idea, but a real endocrine pathway with measurable hormonal effects. So listen carefully, drink water with intention. Do not wait until your mouth is dry, your head aches, your mood drops, and your concentration collapses. Build hydration into the day before the body begins sending louder signals. Why? Because hydration is not just about thirst. It is about blood volume, brain function, autonomic balance, kidney signaling, temperature regulation, and the hormonal chemistry of stress. And how can drinking water help? It can reduce unnecessary physiological strain, support clearer thinking, soften fatigue, and possibly reduce the intensity of cortisol reactivity when the body faces acute pressure. Let us begin with the first mechanism. Water helps lower the hidden physical load behind mental stress. When you are even mildly underhydrated, the body must defend fluid balance. The kidneys conserve water. Blood becomes more concentrated. The heart may need to work harder to maintain circulation. The brain receives signals that something in the internal environment is not ideal. You may call it being tense, being tired, not feeling like myself, or getting irritated for no reason. But ask, how often is that feeling partly biological? How often is stress being amplified by a basic fluid deficit? The National Academy's dietary reference values estimate total water intake, meaning water from beverages and food, at about 2.7 litres per day for adult women and 3.7 litres per day for adult men in typical conditions. These are not rigid prescriptions for everybody in every climate, but they give us a serious reference point. Many people may be functioning below their optimal hydration pattern without realizing it. So do this. Do not chase a perfect number blindly. Observe your body. Check your morning urine color. Notice your headache pattern. Notice whether your afternoon irritability improves when you drink water earlier in the day. If your urine is consistently dark, if you rarely drink until late afternoon, or if you rely mainly on coffee and sweet drinks, your stress system may be doing extra work. Now let us move deeper. In 2025, a study in the Journal of Applied Physiology examined healthy young adults with low versus high habitual fluid intake. The participants underwent the TRIA social stress test, a well-known laboratory method used to provoke psychosocial stress. Here is the key point. Both groups showed stress responses, but the low fluid intake group had greater cortisol reactivity and darker, more concentrated urine was associated with stronger cortisol response. That means hydration status was not just a comfort issue, it was linked to the hormonal intensity of stress. Pause here and ask, why does this matter? because two people may face the same stressful meeting, the same exam, the same conflict, or the same deadline, but their bodies may not respond with the same hormonal force. If one person is underhydrated, the stress signal may rise higher than necessary, so give the body a better baseline. Drink water before the stressful moment, not only after it. If you know you have a presentation at 2 p.m, do not begin hydrating at 1:55 p.m. Start in the morning. Take small amounts regularly. Let your body enter the challenge with stable fluid balance. Now ask another question. How does water influence mood? Several controlled and observational studies suggest that mild dehydration can affect fatigue, alertness, tension, and perceived mental effort. In a PillOS or knee study on changes in water intake, people who usually drank less water showed improved mood-related measures when they increased water intake, while people who usually drank more water reported worse mood and more negative symptoms when their water intake was reduced. The researchers also noted that mild dehydration has often been linked with fatigue, headache, sleepiness, and concentration difficulties. Think about that in daily life. A person says, "I am overwhelmed." Another says, "I cannot focus." Another says, "Everything is annoying today." Of course, not every emotional state is dehydration. Do not oversimplify human psychology, but also do not ignore physiology. Before you decide that the entire day is emotionally broken, drink water. Wait, breathe, reassess. Give the nervous system one basic condition it needs. Now let us connect this to the brain. The brain is not floating outside the body. It is an organ dependent on circulation, electrolytes, glucose delivery, temperature regulation, and waste clearance. If hydration drops, the brain does not always announce it dramatically. It may whisper through slower thinking, lower patience, heavier fatigue, or a vague sense of unease. How many stressful decisions are made while the brain is simply undersupplied? How many arguments begin when the body is tired, caffeinated, and underhydrated? A systematic review and meta-analysis looking at fluid intake after dehydration found that rehydration can help performance outcomes, especially in demanding conditions such as heat stress, and the review noted that mood measures may be especially sensitive to subtle hydration changes, so use water strategically. When you feel stress rising, do not only say, "calm down." Give the body a physical instruction. Drink slowly, sit upright, breathe through the nose. Let the glass become a pause button. The act itself matters. It interrupts the stress loop, gives the hands something steady to do, slows the pace of reaction, and supports the internal fluid environment at the same time. Now let us address a critical point. Drinking water is not a cure for clinical anxiety disorders, depression, trauma, burnout, or severe chronic stress. Say that clearly. Do not replace professional care with a water bottle. If stress is persistent, disabling, or associated with panic attacks, hopelessness, chest pain, severe insomnia, substance misuse, or thoughts of self-harm, seek medical and mental health support. Water is a supportive intervention, not a complete treatment plan. But supportive interventions matter. Why? Because stress is often built from layers: sleep, hydration, food quality, movement, sunlight, social support, workload, medical conditions, and emotional history all combine. If one layer is easy to improve, improve it. Do not leave easy physiology unattended. There is also population-level evidence worth mentioning carefully. A large cross-sectional study reported that lower plain water intake was associated with higher odds of depression and anxiety in adults, even after adjusting for several lifestyle and dietary factors. Because it was cross-sectional, it cannot prove that low water intake causes anxiety or depression. But it does raise a meaningful clinical question. When mental health is being assessed, should hydration habits be part of the conversation? The answer should be yes. So ask yourself and your audience, how much water did you drink before noon today? What color was your urine this morning? Did your stress peak after hours of coffee and no water? Did you confuse thirst with hunger, fatigue, or anger? Now let us make this practical. First, start the day with water. Before the phone, before the flood of messages, before the first rush of responsibility, drink a glass. Why? Overnight, you lose water through breathing, sweating, and urine production. Morning hydration gives your cardiovascular and nervous systems a better start. Second, pair water with existing habits. Drink after waking, with each meal, before caffeine, during work blocks, after bathroom breaks, and before exercise. Do not rely on memory. Attach water to routines that already happen. Third, use small, repeated doses. Do not force huge amounts at once. The goal is steady hydration, not discomfort. Sip across the day. Let the body absorb and regulate. Fourth, watch the stress windows. Many people become tense late morning, mid-afternoon, or evening. So place water before those times. If your difficult meeting is at 10 a.m., drink earlier. If your energy crashes at 3 p.m., hydrate at 1:30 and 2:30. Do not wait for the crash, intercept it. Fifth, respect electrolytes when needed. If you are sweating heavily, exercising for long periods, working in heat, vomiting, having diarrhea, or losing fluid rapidly, plain water alone may not always be enough. Sodium and other electrolytes may matter. In ordinary daily life, food usually supplies electrolytes, but under heavy fluid loss, be more thoughtful. Sixth, do not overdo it. More is not always better. Excessive water intake can lower blood sodium and become dangerous, especially when large amounts are consumed rapidly. People with kidney disease, heart failure, liver disease, adrenal disorders, or fluid restrictions should follow medical guidance. Be disciplined, not extreme. Seventh, replace some stress-amplifying beverages. If your day is built on caffeine and sugary drinks, shift part of that pattern toward plain water. The CDC emphasizes water as a healthier drink choice and encourages replacing sugar-sweetened beverages with water when possible. Now here is the deeper lesson. Water helps because it gives the body one less emergency to manage. Stress already asks the body to mobilize. It raises alertness. It changes heart rate. It shifts hormones. It sharpens threat detection. If dehydration is present, the body must also defend fluid balance. Why make the stress response carry two burdens at once? Give the body stability. Give the brain circulation. Give the kidneys enough fluid to regulate. Give the stress system fewer reasons to overreact. So remember this. Drinking water is not merely a health habit. It is a biological message. It tells the body, you are supported. You do not need to fight thirst and pressure at the same time. When stress begins, ask, have I hydrated today? How is my body interpreting this moment? Am I emotionally overwhelmed, or am I also physiologically underprepared? Then act. Drink water early. Drink it steadily. Use it before pressure, during pressure, and after pressure. Watch your body's signals. Stay balanced. Seek medical care when stress is severe. But never underestimate the quiet intervention sitting in a simple glass. Take care of your body as if your mind lives there, because it does. Thank you, everyone. Stay well, stay close, and let us keep learning together like a family. See you in the next topic.